My name is Kason Pierce. I am one of the associate directors of the Transitions to Residency course, and clinically I am a hospitalist based at Denver Health. I wanted to make a video just to give our faculty facilitators some information about the Serious News 201 session. First of all, thank you all so much for dedicating your time to the education of our students and helping to prepare them for the transitions to residency, and specifically the Serious News 201 session, which is designed to improve their advanced communication skills to allow them to work through challenging conversations with patients in an unsupervised setting. In terms of the structure of these sessions, our students are divided into groups of typically 4 or 5. All of the students are pre-assigned the specific scenario that they are asked to role play with the standardized patients. And within those assignments, they are given some encounter goals, which allows them to focus on the role play and the specific aspects that we feel are most important for each specific case. The Serious News 201 cases are designed to focus primarily on communication skills. The medical aspects or the details of medical management really are not a focus of this course, just for your information. Within each student group, the students are assigned roles while they're in the room with the standardized patient. So one person will be doing the role play. A second student who is not doing the role play will be asked to pay attention to the Spike's nurse model adherence and to take notes for feedback at the end of the session. A second student who is not role playing is asked to watch for nonverbal cues, and the third student is asked to look at word choice and help keep time during the session. In general, the role play should last about 15 minutes. Students are allowed to take a timeout and ask to pause. The standardized patients also have the ability to put a pause on the session if the role play is sort of going where it shouldn't, or if there's something particularly challenging and there needs to be a pause and a break and some provision of space. There are a very small number of students each year who really struggle with the emotional aspects of these cases, and sometimes, rarely, students have needed to pause and step out of the room. We deliberately assign our faculty to be present for the most emotionally intense of these cases, and so if you're in a room where that happens, we ask you to step out with the student and try to provide emotional support. We also always have one of our directors in the CAPE for these sessions there to provide additional support for students and faculty if this happens. The role play with the SP should unfold and last about 15 minutes. At the end of the 15-minute role play, the student who is doing the role play will be asked to provide some self-reflection and ask for particular areas that they would like feedback on. The initial period of feedback really should be just between the student doing the role play and the standardized patient. And so we build that time in so that the standardized patients can have ample time to provide feedback on how the communication felt as they were receiving it from the student doing the role play. After the standardized patient and the student have done that initial feedback, there is additional time at the end of each encounter built in where the standardized patient steps out of the room, and that is your opportunity as the faculty and the opportunity of the other students who are observing to do more specific feedback and debriefing with the student who did the role play. Thank you all again for teaching our students and for facilitating these sessions. We could never do this course without you, and certainly this aspect is critically important to our students' clinical care as they proceed into internship and residency. Thank you.